Father Factory is a coaching service for dads that addresses the intergenerational impact of their trauma from childhood sexual violence. Voice lessons will help to bridge the traumatic past with its current developed spiritual, medical, physical, and behavioral conditions that are the result of CSV. Join us to help dads be intentional parents.
Our guest today is Dr. Kerry-Ann Williams.
Dr. Kerry-Ann Williams is a child and adolescent psychiatrist and chief medical officer at Justice Resource Institute, a nonprofit mental health and social justice agency in Boston, Massachusetts. Dr. Williams is a part-time lecturer in the Harvard Medical School Cambridge Health Alliance psychiatry training programs, where she directs seminars for psychiatry residents and child psychiatry fellows. Dr. Williams specializes in the treatment of post-traumatic stress disorder in children and adults and is trained in cognitive behavior therapy for depression and anxiety. She hosts a podcast called Black Mental Health Matters with Dr. Kerry-Ann.
Okay, welcome, Dr. Kerry-Ann Williams. We are really excited about having you here. Welcome to the podcast of the Father Factory Voice Lessons.
Well, thank you for having me. It is an honor to be on your podcast, Hassan.
Thank you. Thank you. We recently did a podcast together, your podcast, and it was really, really great. So you guys that haven't gotten the opportunity to see that, I'll have it in the links down there. You can definitely check that out. It's very useful, very really great information. And it made me say, you must have her on your podcast. You got to get her to come to your podcast. So Dr. Kerry-Ann, please tell our audience a little bit about like what you're doing. I know you're we said a couple of things in your introduction, but tell us a little bit about the work that you do.
Well, at first, I just wanted to say that I had a very amazing interview with you. I think it was just a very worthwhile discussion, and there was just so much to glean from that interview. And so it's definitely my honor to come on your podcast and see what I can offer to your audience. So I am a child and adolescent psychiatrist, which means that I'm trained in working with adults first, but then subspecializing in working with children and teenagers. And what that means is that I am a physician trained in medicine, but then subspecializing in psychiatric medicine. And so my training kind of includes psychology and psychiatry in that way. It includes kind of psychological principles and managing medications and understanding the biological cause of mental health issues. And so I really enjoy that work a lot because it kind of appeals to the geeky science kind of nerd, kind of understanding what brain areas kind of are responsible for what, but at the same time, the psychology kind of understanding human behavior and why people do things the way they do them, and especially children, which they're kind of a little enigmas, in terms of like why they do things the way they do it. And sometimes they can do something one day and then another day they seem to not be able to suddenly do this certain thing. And it's kind of confusing. So I really like the area that I'm in. And for years, I did clinical work at residential schools, which are where, kids go if they have very severe mental health concerns that just couldn't be resolved in the community.
Can you give me an idea of severe? Like, what would you say? So
severe, really the definition of severe is kind of just defined by, we've tried kind of working at this in a regular clinic. We maybe tried, maybe that person's been hospitalized even and then discharged. Maybe they've had multiple hospitalizations and someone said, you know what, let's break the cycle of hospitalizations by having them kind of actually go to a more long-term place to work through the issue and then go back home. And so that actually could be someone who had severe trauma. And then the effects of that trauma are just such that we've tried maybe medication, we've tried therapy, we've tried all these other supports, but maybe they're still kind of having symptoms, for example, suicidality, just recurrent suicidality, or maybe they have recurrent aggression. And, whenever they get angry, they try to hurt themselves or other people. Sometimes they are just having problems in school. Maybe they won't go to school. They're school avoidance. And sometimes if you miss enough school days, you have to go to a special school. You have to go to a residential school.
Wow.
So sometimes that's a reason too. And again, we have kids of varying abilities. Sometimes there's intellectual problems. Sometimes there aren't. So yeah, so and then sometimes there's just really complex things like psychosis. They just need to kind of be able to get to a place where they can then get back into the community and be okay. And so that's been the group that I've worked with for maybe about 11 years or so.
Wow. And what age range?
Primarily adolescents, but our agency also has programs for age 6 to 12, but I primarily worked with adolescents.
Wow. And so this is right after toddlers. Like, give us that age range of adolescents.
So adolescents would be age 12 to 22. We consider young adults to kind of still be you're an adolescent till you're 26.
Really?
You're an adolescent till you're 26, but we see them up to about 21 or so. Yeah.
And I'm sure that probably has to do with the functioning of the brain and how the brain develops and different things
exactly.
like that. Yeah. Oh,
yeah.
wow.
Yeah. So it's just really interesting because that's part of what I look at is, how is it that their brain development kind of sets them up for this mental health issue or their recovery from it. And so, yeah, and right now, though, I've kind of taken a step back from some of the clinical work. I do primarily administrative work. I am the chief medical officer of an organization called Justice Resource Institute, JRI. And so I'm full-time administrative there, doing supervision, overseeing systems, basically trying to make the world a better place by overseeing the systems that govern the people who are delivering the care. And that's what I've been doing more recently. But I still have a small private practice, and I'll probably expand in a year or so. But yeah.
Nice.
And then my hobby, the podcast is my hobby. And that's something I started actually in 2020.
Oh, wow.
right before the COVID kind of pandemic. And it started its life as a radio show on a kind of a small Black-owned radio station. It was a radio show. It was a call-in radio program. People could call in and ask questions.
And give us the name of the podcast.
It's called Black Mental Health Matters.
Yes.
And so then the next year, I kind of transitioned out of doing it as a radio show and just did it as a podcast. Initially, it was a live podcast still, but then now I've just made it a pre-recorded podcast. And it's just called Black Mental Health Matters with Dr. Kerry-Ann.
Nice.
And it's available on any major podcasting platform, and it's available as a video podcast on YouTube as well.
Nice. And what are some of the things you're covering during the podcast?
So this podcast is meant to kind of elevate providers of color that are doing good work in the mental health space, and also providers who are just providing services that help people in the Black community, but also and beyond. So I always kind of say this is for people in the Black community and beyond, because mental health topics help everybody. But I always just wanted to make sure to kind of always include a little something there for things that are relevant to our community. So for example, people, might talk about what does trauma look like, right? And I might have an episode talking about what trauma looks like. I'll throw a little bit of something in there about here's what trauma might look like if you're pulled over by the police. It might look like running away. It might look like, trying to fight because, trauma responses involve fighting or running away and things like that. And so, you don't just run because you're guilty. You run because you're scared, or because you're startled. So I might include a little bit of that in an episode, so it has a little bit of something there usually. Yeah.
That's really powerful. And I'm imagining how useful that will be for police departments and people that actually experience the trauma response, right? So they are seeing someone kind of acting out and they may label it one thing, but it may be just that trauma response. And then how great would it be for us to deal with those individuals on that level, right? Understanding that it's a trauma response. So we will keep you in prayer so that we can keep out there to do all that wonderful stuff. So guys, today we're going to dive into a number of things that is going to be very useful for you, for your child, for anyone that any adult, any child that has experienced trauma. And we're going to really discuss this and really jump into it. And the first thing I want to ask Dr. Kerry-Ann is why Black mental health?
Mm-hmm. Well, I did initially consider just having it general, but I guess two things. One was one was honestly the opportunity to be on a predominantly Black kind of owned radio station, and that was a community that I was going to be talking to. But the second thing was in my own work, I started noticing some patterns of who came for mental health treatment. Who was I seeing in my clinic? And I just noticed a pattern that I would see sometimes more, people of color, more Black people in the ER and the hospital, and not so much in the clinic sometimes. And I realized that there are certain groups of people that have more kind of literacy around mental health, and they will engage in more preventative care. They'll come when their symptoms are mild. And they'll say, oh, you have a little bit of depression. My child has a little bit of ADHD. And they can get treatment early, and their child never gets pulled out of school, and they can kind of like go straight through. And then sometimes I found, I mean, not 100%, but just in general, that I found that individuals in the Black community would sometimes wait until things were severe. And so then now it disrupted their life. And now they're in the ER in a manic episode, or in the hospital with psychosis. And it's, that kind of that time for early intervention got lost. And I thought, how can I help the community to be able to recognize early that there could be a problem, and that it's okay to go get help early, and that actually it's better. Your child their education won't be disrupted. You won't be disrupted with your ability to work and provide for your family. You'll overall have a kind of a better kind of trajectory. Your illness will have a better trajectory if you kind of have early treatment, and if you understand what's going on. And it also will help people who are listening to help their family members or other people that are in their lives, to kind of encourage them. And so it was really about increasing mental health literacy so that I could see more equity in how mental health services were accessed, and the kind of benefits that people really got from receiving services.
That's really cool, right? Because in doing my work with children for many years and families, we ran a program working with families that were expecting all the way up to the age of 3. And what I noticed is that these services were available. Early intervention was available. And just as you said, they were not participating, and maybe because a lot of it was like, I don't want my child labeled, right? A lot of it also was like, and we'll talk about this a little later, like grieving the child you thought you would have, right? This idea of like, I'm not even accepting that this is an issue. So what I started realizing is that there was on one side people that didn't as much need the services, that were doing it as a preventive, as you mentioned, right? And what's interesting with that is, right, they would do it as a preventative. And then I think like down the line, some of the things that we started seeing, and even now, is the adverse effect of it, right? That it really almost served as a pampering in areas that it didn't need to take place, right? And now these kids aren't as functional as they need to be because they got services that really weren't needed. And then on the other end, there were those that really need the services that avoided going to get the services. And then now here we are where there's a lot of dysfunction that's actually going on. So you raise a really great point around that. And I think that is something that the screening around this maybe needs to get better, of how we really are taking in people that need the services with these early intervention services. So really great point. Really, really great. Yeah.
And I that sentiment exactly. There's been times where kids have been pulled from the classroom and put in special classrooms, and they didn't need it. And actually, they would have been better off being kept in a mainstream classroom, because they were just they were getting services they kind of didn't need, or getting special attention in that way. But they were placed in and really, and sometimes actually being in the main classroom and getting maybe being kind of diagnosed the right way, or kind of being assessed the right way. What do I really need to be able to kind of stay in the mainstream classroom? So that exactly, like sometimes people are getting services that maybe they didn't need, and they end up not doing as well. So how do we kind of like, and that's part of the the mission with the podcast, is helping people to think through how to kind of ask the questions to their school and that sort of thing.
Nice, right? Because That's the hang up, right? Like I don't know what to say or what to ask about when it comes to this issue, and I'm kind of stumped in terms of that. And so, Dr. Kerry-Ann, you know well the work that I do and working with men who have experienced molestation, sexual abuse, and really working with them to deal with the impact of that. And so I want to go along those lines of thinking about that particularly, right? And how it affects children. And so my question is, how does a parent's unresolved trauma, particularly from sexual abuse, manifest in emotional or behavioral patterns in their children? And we can discuss that. So the idea here is like what are the specific signs that might indicate that a child is being indirectly affected by their parents' trauma?
Wow. I mean, and that's kind of a big question because it kind of, in some ways, it really just depends on the household. And I would almost say it kind of starts with the parent first, recognizing
Yeah.
how they are behaving as a result of their trauma.
Mhm.
And then from there, kind of
Yeah.
thinking, okay, how might that actually be affecting the
Yeah.
way that my child interacts with me? So
Yeah.
children kind of operate in an attachment relationship with
Yeah.
their parents.
Yeah.
And from the time that they're born, the caregiver is their world.
Yeah.
Right. And so everything that's going on with the caregiver emotionally and so on, the child can experience that emotionally as well. They kind of experience it in their bodies, even though they don't have the language to describe it.
Wow.
And so, they can pick up on anxiety, distress,
Mhm.
tension, sadness.
Mhm.
They feel the emotions, but they don't have language to describe it, and they don't have the ability to kind of regulate it. So children can then absorb the negative affect, as we call it. They can experience irritability.
Yeah.
Irritability is often one of the telltale signs that something is kind of not right, and you have to kind of figure out what's causing it. Irritability is a non-specific symptom, but irritability is something that we sometimes see in children who are in a situation like that as irritability, and then it can cause frustration for the parent.
Yeah, I remember looking at a YouTube clip that was talking about Holocaust survivors and those women that were pregnant during the time and then giving birth to children that constantly cried,
Hmm.
like
Hmm.
constantly cried. And I think of that, and I think of that, where we have stories of the Holocaust well documented and not as documented when it comes to African American slaves, but you can imagine that's the case, right?
Hmm.
It's the
Hmm.
case that your great grandmother, your mother, your like just down the line
Hmm.
experience not feeling safe.
Right.
And now here you come along, and you might not have experienced what they've experienced, but
Hmm.
you've gotten the impact of that, all of the
Hmm.
emotion, all of the
Hmm.
DNA, if just
Hmm.
we can say that, right?
Yeah.
That just pours into you, and now you are kind of wrestling and dealing with just that.
Yeah. And I will just add there that there is some biology to that,
Good.
that people can actually inherit gene vulnerabilities to certain things, right?
Is
So there are theories
that
that
genetics? Is it?
genetics, right? So
Yes.
part of your genetics. So your DNA,
Yeah.
right, is if you experience certain kinds of trauma,
Yeah.
it can actually affect your DNA in certain ways that can then be passed on,
Wow.
right? And so they'll say, oh, from biology, those add these groups or those groups, and it kind of silences this gene or turns this gene on or whatever, and it
Yeah.
creates these gene vulnerabilities.
Hmm.
And then that can potentially be passed on. So that what that might look like is your child now has a vulnerability to develop depression. They
Mm.
have a vulnerability to develop bipolar disorder. They have a vulnerability for this. And that doesn't mean they're definitely going to get it,
Yeah.
but maybe under the right circumstances. So maybe they're fine. And then at age 25, they encounter some stressor and then they kind of start to experience symptoms because they had this like vulnerability for
Yeah.
that they inherited. So these are some things that, I mean, that's just a generality, but it's a theory that you can potentially have some biological things that you can inherit because your ancestors experienced traumatic stress.
Wow.
And then, as I said, on top of that, there's just a psychological part of it where if your caregiver is experiencing stress, that the infant can just experience that in their bodies, even
Yeah.
though they don't have a way to really regulate it.
Yeah, and I love that you've done studies with mind, body, right, and brain, what parts of the brains are affected. And then I'm just thinking of how, what's happening in the brain is impacting the body in such a way where we are seeing high or hypertension, and as you
Mhm.
mentioned, depression,
Yeah.
diabetes. We're seeing cancer as well, right? Because
Mhm. Mhm.
really, if you and this is, I'm not a medical person, people, so don't don't take all this with me, right? But just this idea of the inflammation that's built up in the body, right?
Mhm. Mhm.
And over maybe years of being exposed to being your immune system being just
Mhm.
on fight and flight, right?
Mhm.
Like it's always in this position of it's being unsafe, and now you're open and vulnerable to all of this that's going on. So that's fascinating to me to think about that. That's a lot of the work that we do with the Father Factory to really kind of call that into the light so that we are paying attention to that. I imagine parents are hearing this and feeling like guilty,
Mhm.
right? And feeling like I passed on to my child something that I would not want them to have. Is this repairable? Is this something that we can deal with? How do we do that? What do we look to?
Well, I would just say about the kind of guilt about passing things on is that we're all broken people.
Yeah, yeah,
Right. And so maybe one person's brokenness is not another person's brokenness, but
yeah,
I don't know if I know of a person and that I've ever met that hasn't experienced some kind of brokenness.
yeah,
You know,
yeah,
I think that's just the way of humanity, of being
yeah,
human.
yeah,
And so I think to live is to experience some degree of brokenness
yeah,
of some part of your mind or body. And so inevitably your child, even though we wish for them to be as perfect as possible,
yeah,
they're human. And so they will have some things that are inherited and some things that are not, that are just environmental. There's
yeah,
some things you can't protect them from.
yeah.
And so what we do is the best we can to scaffold and to, some of the things that we think about are first the care, what we call the caregiver, because there's parents, there's grandparents, there's aunts, uncles, that sort of thing. There's teachers. The caregiver has to first have a means of regulating themselves, of kind of understanding themselves and taking care of themselves. And
Yeah.
that's the first step really to being able to help your child, is that you need to kind of sort yourself out. No, that's not 100%. You can't sort yourself out 100%, but you do the best and you're kind of
Yeah.
doing your best to kind of make sure that you have what you need. The second thing is being able to attune to know what your child needs. What are they communicating to you?
Mm,
You think of all behavior as communication,
yeah.
right? Every time a child does something, sometimes they're saying something and that's clear communication, but then when they do something, they're communicating something, whether it's a negative behavior or positive behavior, right? So trying to figure out what it is that your child really needs when they do something, even what they really need when they say something, kind of attuning to the need underneath maybe the behavior or the words,
Yeah.
that you can address what they really want. So for example, a child may be acting out, but when you attune to it, you say, oh, you know what? What's really going on is that they're hungry and they
Yeah.
need a snack. They're not really mad at me. They're
Yeah.
just hungry. So that's an example of like attuning to what the real need is,
Yeah.
despite the behavior being, whatever it might be.
Right.
And so those are some of the things that I kind of think about as kind of like the starting points,
Yeah.
is kind of being able to attend to what the child needs underneath that.
Yeah. Yeah.
I'll start there.
Yeah. I think that's a great place to start. I'll add to that to say I just finished reading a book and I'm reading it again. It's really that good. Man's Search for Meaning by Victor.
Viktor Frankl.
Oh
Hmm.
gosh,
Yeah.
I was like, whoa. Right? And it aligns with so much of what I've been studying and what I teach also with the men that I work with, right? Like, suffering is meaningful, right? There's meaning in suffering, right? And there's an aim in suffering as well. I often talk about this idea of like, had I not suffered in anything, or anyone suffered in anything, we probably wouldn't even have businesses the way we have them, right? This was a result. If you just think about it, right? All businesses are really a result of someone saying, hey, I lacked that particular thing. I suffered in this particular area. Let me create this thing that will help towards that issue. And so while suffering isn't something that anyone wants to actually experience, it is the very thing that brings us to real wholeness. Like there's really great benefits from it. A little earlier, we were talking about something, and it reminded me of a quote that he said in a book. He said, abnormal response to an abnormal situation is normal. I thought of that, like when you were talking about with the trauma response that a person is having at a particular time, and so parents don't feel guilty, right? It's normal to have experienced something. It's not. I'd say it's irrational to not want to have experienced something that you already experienced, right? Which is probably cognitive behavior therapy, right? So it's really embracing what has happened and then finding in that the way that you will be there for other people. And that's how your healing comes about. That's how your wholeness comes about. So that's great. Thank you. Thank you for that. That was really great. I want to move on to think about when a parent is triggered by their child's by their child, and their child is at the developmental stage that parent experienced their trauma, right? What are ways that we can identify that and help keep children safe? And I'll dive into that a little more, right? A bit of my work is thinking about intergenerational trauma and the impact of that, and then thinking like perhaps some of the ways that people respond to their children is to their children's normal developmental stage, right? They're responding out of their trauma from their developmental stage that they've actually experienced trauma. Hope that makes sense.
Yeah, no, that absolutely makes sense because it can actually be, kind of seeing your child kind of go through a stage that you went through and where you had a certain experience, can definitely bring things up. And I think what people may not realize is that this idea of being conscious versus kind of unconscious, right? And when something is conscious, you're aware of it. You know it's happening.
Yeah.
But maybe you can't stop yourself or whatnot, but you know it's happening. But when something is unconscious, you actually don't know it's happening. And so that's kind of where it's a little bit more, difficult, because if you can't see it happening, it's hard to kind of intervene. And in that stage, that's where someone else is maybe pointing something out and saying, hey, I'm noticing this, I'm noticing that. That's where, for example, if you're seeing a therapist and you describe a situation, they may say, I am noticing this pattern based on what you're describing, right? And so, it's again, not a comprehensive answer, but some of the things that you could notice. One is avoidance. So let's say, for example, someone experienced sexual abuse and now their child is going through puberty and you have to have the talk with them. You may avoid that talk with them, or you may feel kind of withdraw because something about that, you're just procrastinating and procrastinating and procrastinating. Oh, I'll tell them later. I'll talk to them about it later. And something about having that talk is just triggering something inside of you. And so that avoidance, it's kind of like you're avoiding your trauma, but you're also then avoiding your child to kind of go through their developmental stage. And they need to hear it from you, and so avoidance could be one thing. If you find yourself avoiding certain situations or kind of dealing with certain things. Maybe you experience physical trauma. Someone really hit you, beat you, and now you have a hard time even just disciplining your child with words, because we don't recommend physical discipline, but even just kind of disciplining them in general, maybe it might be kind of difficult for you because you don't want to be too harsh with them because you had harsh parenting yourself, and so kind of again that avoidance. Because you don't want them to experience what you experienced. So that could be a sign that now what you experience is kind of interfering with their own development or what they need to do. So that's one thing.
I love that, right? That avoidance that is undetectable, it seems really difficult to do, but it's why we were made to live in community, right? Because somebody will point it out to you, right? In the Bible, it is this idea of an adversary, right? Actually, an opponent, someone that opposes you, right? And one of the really great things that I think Jordan Peterson actually points out is that your enemies will show you your blind spots. And it's this really great idea of like, wow, like pay attention to what you might be being called out on, right? So you can benefit from enemies as well as friends, right? And in that you can then pay attention to what's going on, get attuned to yourself. The Bible says, love your neighbor as you love yourself, right? And you think of that like, okay, how does that, play out and what does that look like? If I've attended to myself and I've noticed certain things about me, I then can know what I'm projecting onto others and what I don't want to project onto others. I want to, be aware of that. So it really is a really great thing to stop and say, am I avoiding this? And if I'm avoiding this, this is something to deal with, right? The very thing I'm avoiding is to deal with. And I like to say, press into your pain, right? Because that's the only way courage comes. That's the only way you get to the other side of it, right? Because it's unavoidable. It's either you're going to choose to press into your pain or the pain is going to come when it wants to come, right? So it's great to know what's happening and then to walk right into it. So I think that that's really great for parents to pay attention to and to look at, and ways of being able to recognize, like, wow, I experienced this at this age, and maybe even stopping to acknowledge where was the age that I experienced this trauma.
Right.
I think, sometimes because things are so painful, people are avoiding it all the way through. They're avoiding even the memory of it or anything like that. And anything you do that to becomes bigger, and it's becomes more of a monster, right? And and this is going to feel harsh to hear, right? But you make it more of a monster than it actually was. Right. So while it was painful and experience, but now we've exaggerated it to an extent that it's something we do not want to do. Right. We want cognitive dissonance when it comes to this so that we could just keep going. But the reality is that we're not going. We're not moving forward. We're actually marching in place. And so in order to actually march forward, we want to deal with just that.
Yeah,
So
and what that can lead to is if you're avoiding, you're not processing it. And then on the flip side, you could end up overreacting at other times.
Yeah.
So you're underreacting at this time and then overreacting at another time. And so another kind of thing that we can see is disproportionate reactions to kind of things that could be developmentally normal, or a little misbehavior here or there, just kind of this disproportionate reaction. Because again, if your system is kind of primed for survival, and again they're going through that age that you had to be in survival mode, it could kind of trigger you to kind of respond as though this is life or death when it isn't. And so then it's kind of a disproportionate reaction, a disproportionate anger to maybe a small misgiving.
Yeah. Love it. I love when you said the piece of kind of finding out what's beneath, right? The very emotion that's coming out. Oftentimes, so I teach domestic violence classes for men. and we talk about anger. And we talk about anger in the sense that it is a secondary emotion, right? And so that it actually masks all other emotions.
Yeah.
So what we really want to think about when we say we're angry, the real idea of angry is that we felt that there was some injustice done to us,
Mhm.
right? And so if we explore that and dig a little deeper, we might feel that we feel unappreciated, right? We feel overlooked. We feel disrespected. We feel worried. We feel shocked. It's a number of things that can be underneath that particular thing of anger. I always talk about that, particularly with men, is that it is the acceptable emotion that society says that we can have, right? If there's a
Wow.
superhero that men can have, it's the Hulk, right? It's acceptable to be the Hulk, right? But it is unacceptable in many ways for a man. And I always use this example is that you're at the Super Bowl party this weekend, Super Bowl, right? We're at the Super Bowl party, and a commercial comes on, and all your boys are there. And is there an opportunity or a space there for you where if you want to break down crying, that you can cry on the shoulder of your friend? And they like,
Mm.
no,
Wow.
you know what would happen to you if you did that? Yeah, it's the same thing that we can perpetually do. It we can change that dynamic, right? And not that we just want to be going around crying, but we
Yeah.
want to be authentic in moments, right? And not be told that that is wrong. And so I feel like I went a couple of different places with that, but I think what you raised is really great to in discussing this. I want to move to ask this question. What does healthy and healthy versus unhealthy emotional processing look like in children who have experienced trauma? And then really like, how can parents facilitate healthy processing?
Wow. Well, you know, again, there's kind of this the trauma reaction kind of guides
Mm,
how people kind of might respond. And so one of the unhealthy ways that children can cope is by pulling away from their supports. You
yeah,
know, kind of that image of uh, I remember in this children's movie, The Beauty and the Beast,
yeah,
the Beast, he got like a wound on his arm, and like that she wanted to help him, and he's like, oh, it's covering the wound, like don't touch me, you
yeah,
know. And so when people get this wound, sometimes there's like this sense of like, oh, I'm just gonna go to my room and like just close
yeah,
the door and don't come in. I'm hurting too much,
yeah,
and there's kind of this sense of pulling away
yeah,
and feel like I'll just listen to music. I'll do things on my own. And that could be, I mean, you know, regulating on your own is definitely a part of it, but pulling away from social supports is a very unhealthy strategy.
yeah,
And so the healthy strategy would be to engage with your support system,
yeah,
people who really do care about you, kind
yeah.
of get out, talk, use distractions, go watch a movie, do other things. So you do need to connect with your social supports. Um,
I don't
you
want you to
know,
lose your thought, but you're raising something really great, and I'm thinking that parents, how do we help parents to teach children to do that, right?
Mhm.
Because that's a natural instinct in all of us, right? And especially if it's in an environment where you are told to man up. Right, or you're told to
Mhm.
like, what? Come on, little girl. I've been through more than that in life.
Mhm.
This is just what Black women gotta go
Yeah.
through. Like, deal with
Mhm.
it, right? Or
Mhm.
anyone
Mhm.
for that matter, right? Like, we're tough people. We're a tough family. We deal with stuff head on, and
Mhm.
how do we support them in thinking about that? Yeah,
Wow, because there's kind of like two things at play there. So one is, of course, creating space for them to be vulnerable.
yeah, yeah,
And I think sometimes if you're in a family that identifies around strength,
yeah,
then they sometimes don't create spaces to be
yeah,
vulnerable because they're identifying so much with strength. So I think, you know, being that parent that a child can go to find both strength, but also to kind of share their weaknesses
yeah,
without being kind of invalidated. I
yeah,
think is really important. So I think it's important for us and our families to kind of think about that. Like,
yeah,
can parents be a place for children to come to and be honest?
Yeah.
about how they're feeling, and for a parent to then respond by saying, your feeling is valid.
Yeah.
You know what? If that happened to me, I would be sad too. If that happened to me, I would be upset as well. Your feeling is valid. Let's talk about how we're going to help to get you to work through that feeling so that you can be back to feeling stronger. So the feeling is okay, but we also need to work on being strong too. You can't spend all day in that feeling. Like you can experience that feeling for a period of time, but you need to kind of work towards how do you kind of get through it, because that's life. You
Yeah.
you kind of have this feeling and you work through it, and you're going to have that feeling again and work through it again. So kind of giving that guidance for how to kind of experience something, let yourself experience it. It's okay, but
Yeah.
now let's work on being strong too, and kind of find that balance. That's
Yeah.
definitely something that parents can
Yeah. I think
provide.
that's really great. And it makes me think of the story of the parable of the prodigal son. Right? And all through this parable, so you see that there is this king that his son comes and he's like, "Listen, I want my money now. I'm not willing to wait till you die. I consider you dead in my eyes. Give me my money now." Right? And how hurtful can that be for a parent to kind of hear that, right? But the parent, right? The king says, "Okay," like gives him everything, and the son goes out and uses it recklessly as what we'll do when anything premature comes to us, right? He uses it recklessly, and then he comes back. He remembers when he's at his lowest point that he can come back. And I always think about that part there. Like he's not just coming back just out of the desperation of his situation, but he's coming back out of knowing that there was unconditional love that was set
Hmm.
forth for me. Like I can come filthy any kind of way. I can come with this wound like
Hmm.
this, and
Hmm.
unconditionally, I am accepted. I'm taking in. And it's fascinating because the parable goes that the king sees the son afar off.
Hmm.
And then he goes and he runs out to the sons, right? So it's not like, yeah, you come crawling back to me and now I'm going to tell you, right? It's unconditional love. And I love you in this regard that I'm going to run out my action, my behavior, my mindset, everything is for you and towards you. And let's deal with what you're ready to deal with now. And so I think, it's a great takeaway for parents to think about unconditional love wherever, whatever the child is experiencing, that they know that this is always a place for you.
Hmm.
This is always a place for you to share hurts, pains, and I think the way that gets done is just what you said. I know how that feels. That hurts. Yeah, I've been there. That hurts as well, right?
Hmm.
Um, I've had that happen to me as well. And this is one of the things that I did, right? Because what we're seeing these days is that children are descending into depression and being apart from families, right?
Hmm.
Diving into video games. We can't even just say kids these days, right? It's like grown men, right?
Yeah.
It's like, so this diving into video games or diving into maybe porn or diving into just a number of things
Hmm.
that tear them away
Hmm.
from family. And imagine what it would look like if they felt and understood this unconditional love so
Yeah.
that in any situation, we can help you process what actually is taking place.
Hmm.
Yeah.
Yeah, yeah, and it just kind of strikes me, that story of the prodigal son, as you mentioned, the father must have done something to create an environment that
Yes.
that son knew he could come back to,
Yes.
despite doing what he did, which is so interesting, that he first felt empowered to kind of go away like that, but then
Yeah.
he actually came back. I mean, he felt ashamed, but he came back, and the father prioritized the relationship over any grievance, which
Yeah.
I thought was very interesting in the story that you
Yeah.
shared.
Yeah.
is a kind of an example for parents to prioritize a relationship over grievances. And you said something great about the anger underlying this injustice, this feeling of injustice underlying anger, and how the father could have easily just dwelled in that feeling of injustice and been angry,
Yeah.
but he chose relationship and he chose love,
Yeah.
and it's a powerful story.
Yeah. Yeah. Beautiful. Beautiful. All right. So here's where I'm like, this is like in the dirt for me and really good to think about. I love this idea in this story. What does being disciplined before disciplining looks like in practice? So, how can parents regulate their own emotions before responding to their child's behavior? Examples could just fly off the top of my head in so many ways. But I recall even, so I do Zoom meetings with the men that I'll meet with, and sometimes the children are there, right? And it's always interesting to see the interaction with the children because if we feel like we're taking care of business, we need them to just not like to do that with us, right? To understand that and to do that, and then often I'll see the frustration arise around stop, go over there, don't do this, da, 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 da. And I'm like, the type of, I say this even in church, right? I'm like, the only noise that I am perfectly fine with hearing is a child crying or something of the sort, right? But when
Yeah.
adults are talking, that's more of an issue, right?
Yeah.
But this idea of disciplining, when you're disciplined, we used to teach discipline, and we take it from the same model of no spanking. This idea of no spanking. In that time that I was teaching that, I was teaching it from that perspective. And we would talk about self-discipline. Like, what does that look like for you in terms of self-discipline? So can you kind of dig into that with me? What does being disciplined before disciplining look like in practice?
Well, Hassan, I want to start with just a frame for the idea of discipline
Yes.
and the idea that what does a parent really want when they discipline their child? The difference between discipline and punishment, right?
Yeah.
Because, punishment is, you did this thing that's wrong. And so you need to do this kind of almost to kind of, I don't know, I don't want to use the word retribution, but it's like you're kind of paying for your sins.
Yeah. Yeah.
Whereas discipline, when you ask most parents, what do you want to do when you discipline? They want to teach them how to do the thing differently the next time.
Yes.
Really, discipline is about teaching. They want their child to learn how to do things differently the next time. And so historically, the thought was, well, if I, spank them, they're going to learn to do it differently. But now we know that there are more effective methods of teaching than using physical discipline, right? And so in order to teach, you can't teach if you're not regulated. You can't teach your child if you're not in a regulated place. If you're angry, if you're annoyed, you're not going to be able to teach them.
And when you say teach, you're saying teach towards positive perspective, in a positive perspective, because you teach and you can teach a very negative.
Yeah, that's true. That's true.
Yeah.
Right, because what you want to do is you want to help to guide your child through to the solution.
Yes.
So the whole premise is that when a child is acting up, they're acting up because they lack a skill. Right? They're lacking some kind of problem solving skill. So if they're bored, they don't know how to entertain themselves, so they're acting up. So there's a skill missing. The skill is they need to learn how to kind of fix their own boredom. Or if they are, acting up because they're jealous of their sister or whatever, there's a skill they need to learn how to manage if their sibling has something they don't have or whatever. There's a skill missing. And so that skill leads to them being dysregulated. They're going to act up because they don't know what else to do, right? They're whatever, 8 years old. They're just going to like yell. They're going to scream because they really don't have the capacity to kind of think through a better solution to the problem. So as the parent, The first step is you have to kind of connect with them. So, because some kids have ADHD, they're not paying attention, looking all around, whatever. You have to connect with them, make sure that you're actually on the same wavelength. And that involves you being regulated and them being regulated.
Mm,
Because if either of you are in a negative space, you're not connecting.
mm,
And once you're able to connect, then you can say, what's wrong? What happened?
mm.
And then they might be crying, oh, so and so took my toy, right? But you have to get to the point where you can kind of calm them down so that they can now talk, because they can't use their verbal skills
Yeah.
if they're in anxious brain, or if they're in distressed brain. They
Yeah.
can't use their talking skills. So you have to be calm, you help them to be calm, and now they can talk. What happened?
Mhm.
Okay, what did they do? What did you do? And then let's talk about what could you have done differently? Because now they're in a brain, they're regulated, so they can talk about what they could have done differently. And now, you might have to have a conversation with them like that 50 times,
Yeah.
but over time, they're going to take it in. What could I have done differently? How could I have solved this problem differently? If the problem happens again and again, you have the same conversation again and again, eventually it will kind of sink in. If this happens, this is what I need to do to solve it. And so what ends up happening is now they're actually learning skills versus just being punished. Because when you punish or when you hit, what the child learns is fear. And what they learn is, what do I need to do to avoid punishment? That's the lesson that they learn. They don't learn anything else. They don't learn social skills. They just learn, what do I need to do to survive so I don't get spanked again? And that's not good enough. That's not
Wow.
good enough, right? So you want them to be able to kind of learn a range of skills that makes them a better person,
Yeah.
not just for them to learn how to avoid being punished.
Yes. So we could definitely do a course on this. I kind of mapped out what you were saying as you were saying it. So let me break it down for everybody that didn't get the chance to kind of grab it all. So if you find that a child is acting out, you want to first lead with the knowledge that it's a lacking of a skill that they have, right? So they're lacking a skill, all right, and then and that they're dysregulated, right, at that time, right? So they're lacking a skill and they're dysregulated based on that lack of skill that they have. You want to then make a connection, and I'll add, like, making connections with children, sometimes getting face to face, right? Letting them feel your love, your unconditional love for them in that moment.
And I'll
Right?
just add there that sometimes
Yeah.
you want to pull them to a different room. Sometimes you don't want to have
Ah,
that conversation in front of all the relatives and shame them. You
ah.
want to actually sometimes have them in a different room. Just want to add that.
And, that's a great insertion, right? Because I think the other thing about that is, like, new space, new case, right?
Yeah.
Like I'm not in the same space, and you're trying to work it. Like, this space just made me wild, right? And now you're
Yeah.
trying to deal with it here. Let me move there. And then what we want to do is, the idea is that we want to get, after we did this connection, we want to go to regulation. So our idea is that we want to get them to regulate. And how we do that is that we want to identify the problem by we want to identify the problem, and you did great by saying, like, like, what's the matter, what happened, right? And we both know, like, in therapy, people come in with presenting problems, right? So they'll say, yeah, she never does this, right? Or he never does that, or da da da. And that's a presenting problem, right? But let's get beneath that, right? And so then what we want to do is we want to be attentive to their behavior. I'm sorry, we want to give a alternative behavior to the problems or the way they act out. And then what then that brings about is a new skill that's built, right? You cannot go through this process unless you have unconditional love for your child. Like, patience would be out of the window, right? Right? Because now, at the point that you acted out, I'ma act out, right? And that's a famous quote too. You act out, I'ma act out with you, right?
Right.
This and then you did this really great thing that said that avoiding punishment happens, and I would say that the avoiding punishment happens when the reverse of this takes place, right? When we are we're going to avoid punishment because it's really going to be this learned behavior, really, so that we can survive this moment.
Yeah.
I always think about, I used to say to parents, I would write on the board and I would say, spanking works. And then they would be like, yeah, now you're on our side, Mr. Hassan. Yes, you're talking my language. And then I would say, so let's see how it works. And I was like, let me ask any of you, how many of you, because these are all expecting parents, I would say, how many of you are looking to raise your kid probably only for like 2 or 3 months? And they were like, I was like, anybody like 1 year? Still no hands? I don't see hands. All right. What about 5 years? Only 5 years. And then after that, they're on their own. They're like, I said, how about the rest of their life? Everybody's like, I'm like, okay. So spanking works in the short term. It's going to make them avoid punishment and not do what you said to do, but it's only going to be in the short term. When you turn your back, they're going to find clever ways to do what they were not able to do. And they're not going to just learn this lesson. And I said, so how does spanking work? And they'd be like, it doesn't work. Yeah, right. So, it's a beautiful thing to think about disciplining yourself, right? Because even like if you are going to, the scripture says this, speak the truth in love, right? Be disciplined before you discipline, right? Judge not lest ye be judged, right? Because the same judgment that you're going to use is going to be used on you. So take the beam out of your eye. I always mix it up. The beam out of your eye, and the log out of your eye, and the little speck out of your neighbor's eye, and then you'll see clearly what you can do and how you can deal with that. And it's all that idea, like be disciplined before you discipline. Right, because the idea is that we are all at fault on some level, and at some level we've been in that very place that others are. All right, so we're wrapping up and getting to probably our last question, and this is the biggest question for me because this is right with what you do, and you can kind of walk us through this. So, medication can be a tool for children dealing with mental health issues, but it also comes with risk. How can parents approach the decision to medication with balance and caution?
Well, the way that we look at medication treatment for children, the first step is the comprehensive assessment. And so, one thing that now, access to treatment is tricky. Sometimes you're going to have a pediatrician that's going to be the one that prescribes, and they're not psychiatrists, so they may not do a full psychiatric assessment. But you can request a referral to a child psychiatrist, and a child psychiatrist will do a comprehensive assessment. And the value of a comprehensive assessment is that it will check for all the possible kind of reasons that your child may be having the problem that they're having. And it helps to rule out if there's anything else going on before starting a medication. So what if it isn't depression? What if it's a medical issue? Maybe they actually need labs done. Maybe they need this or that. And so I think the first step is kind of making sure they don't have medical problems. So the primary care is helpful to make sure they don't have, that they're actually generally healthy. And then a child psychiatrist is helpful because as a physician, they're also kind of thinking about if there's any medical causes to what's going on. The second thing, so that's a biological, kind of making sure there's nothing kind of biological going on. The second thing is actually the environment, the social environment. How might the social environment might be contributing to what we're seeing? So for example, are they acting up in school because they have a learning problem? Has anybody done an assessment to see if they have a math disorder, reading disorder, a vision problem? Like sometimes the behavior, they're not paying attention because they're actually having a learning issue and it's not ADHD. So this is something that you're also needing to look at the social and the environment, the school environment. What are other factors that could be kind of causing the problem that we're seeing? Now, if those things are kind of like addressed and we say, okay, we definitely need a medication. Now the question is, which medication and why, right? And so the principles that a psychiatrist or anyone else who's prescribing a medication should follow is, the medications that have the greatest evidence for that condition you know, as their kind of research to support the use of this medication for this condition. Um, and if so, starting at the lowest kind of necessary dose, or the lowest effective dose, as they call it, so that you're kind of starting low and going slow with increasing the dose. So in psychiatric medications are such that the starting dose is often not the therapeutic dose. You often have to start it and then kind of gradually increase it until you get to the therapeutic dose.
Yeah.
And that's how we assess for like side effects and things like that, is we start off with a low dose to make sure you're tolerating the medication. Then we gradually increase to kind of the therapeutic dose as we see they are tolerating it. Now, some people get benefit from the start, but others need a higher dose. And so that's the other reason we start low, is that some people actually respond to a very low dose. So that should be the approach, is that you kind of start low, go slow, and then you check for side effects. Some medications have less, they have fewer side effects, and then some medications have more. So the other thing is kind of talking with a doctor about what are the side effects and kind of what are the alternatives? What are my choices here? Is this just one medication? Like, do I get to choose between a choice of 3 medications? And let's talk about the risks and benefits of the 3 medications, and I can get to choose. So always ask about alternatives. What are the alternative medications? And why are we going with this one? Why do you strongly recommend this one? What are the kind of the alternative side effects? Because maybe you're okay with this side effect, but not okay with that side effect. And so I kind of, let the parents kind of decide, this medication could cause weight gain. This medication could cause insomnia. This medication could cause headaches. Are you okay with them having trouble sleeping? Or are you okay with them gaining, like what side effect are you kind of willing to risk? Again, it's not 100%, but kind of being able to make that choice, knowing what the side effect profile could be. So that's, and then I would say to being really clear about what you expect the medication to do. I've seen very often where there's a lot of confusion about whether a medication is working or not, and people end up staying on a medication that maybe isn't helping. And it's because we haven't really been clear about what to expect from it. So I think the parent does need to ask the doctor, what do you expect to improve when this medication is started, so I can kind of keep track of that and report it back to you. And also so that I'm not expecting their ADHD to be cured when really the medication is just going to help them to focus for 4 hours or something, So then I have the right expectation and I can report back whether I think it's helping or not. And like, what should the medication not do? It shouldn't make your kid look like a zombie, for example. It shouldn't take their emotions away. It should just help them to be able to regulate their emotions better or whatever. Yeah. So it's just, things like that. I would also just add one more thing, which is when you have a doctor that's prescribing medication, you should feel, if that person has not created an environment in which you feel comfortable asking questions, that's a problem. Yeah. Because I've spoken to so many folks who will say, oh, I don't, they kind of stop the medication and they haven't even talked to their doctor, or they have a problem with the medication and they haven't called the doctor to talk about it. Come to find out, the doctor is just not approachable. They don't feel like they can talk to them. And so it's important to try to find someone who's approachable, though there's not very many psychiatrists. So sometimes you don't have a lot of choice, but it's important to kind of be able to ask those questions and to work with someone that you feel comfortable asking questions to.
Yeah, thank you so much. I think what you said is really important and insightful. I'd like to dig just a little deeper, right? Because I'm just thinking about, if I'm a parent and I'm listening and I am on the cusp of deciding whether I'm going to do this medication for my child or not, or if I am a parent that is already having my child on medication, right? Some of the concerns. And then I'm thinking of alternative medications and more like holistic views or approaches to dealing with children that may have mental health issues. And, I'm very limited in terms of, full understanding of holistic approaches, but just thinking about and you can help dispense some of what I'm about to say, right? Are medications synthetic, and are they trying to replicate the effects that food would normally do in the body to help regulate issues, mental health concerns? And I'll start with that question, and then I'll move to X, uh, uh, more other questions. Yeah.
Mhm. Well, it's an interesting question. And so, I'd venture to say that modern day medicine had its origins in, natural remedies. That's kind of in history, that's where things started. People would make kind of tinctures and
Yeah.
potions and things, and they would make teas.
Yeah.
And so, historically, medicine kind of came from that place where people would use natural remedies. But I think what kind of ended up happening over time, of course, the volume of people needing the remedies increased. But also, in order to have a consistent kind of like treatment and a consistent response,
Mhm.
they needed to be able to quantify how much of something people were receiving. So that I think that then led to things being maybe dehydrated, putting it into pills, whatever, so that you could actually kind of weigh it and measure how much is in this. So we know that you're getting a particular dose, you're getting the same dose each time. There's consistency. And so over time, then, chemists were able to then kind of replicate the chemical structure of things so that we could kind of provide it. I mean, this is just kind of my understanding that it could be
Sure. Yeah.
provided to a greater number of people. Again, consistency in dosing, consistency in quality,
Mhm.
consistency in safety. And the systems that kind of govern the safety of medication. So there's kind of like the whole kind of pharmaceutical system is governed with kind of safety in mind, so
Mhm.
that people,
Value.
well, volume, but also kind of safety and ways to kind of measure efficacy of medication, to kind of keep track of side effects of things,
Okay.
and to make sure that it's safe. If you ingest something, it's not going to like kill you. It's not, the toxicity of things.
Yeah.
And so what we find is that if you have a natural remedy, for example, it may be inconsistent in the dose. You may have more one day and not another day.
Yeah.
And there are sometimes people who take something and their heart stops and they die, because they've taken something and they inadvertently didn't know it has this ingredient that caused their heart to speed up or cause an arrhythmia or something. So they're trying to kind of avoid the tragedies of, people sometimes taking natural remedies that were maybe more active, more medically active than they thought, and maybe or taking too much of it. Maybe the tea was too concentrated, that sort of thing. So it's kind of a long answer, but I think
No, this is
part of the kind of like I'd say war,
yeah.
the part of the war that kind of physicians have with natural supplements is the safety of it. The transparency of sometimes what's in a supplement is not always disclosed to the person purchasing it. Sometimes there are additional ingredients that have some medical action that we don't know. And yeah, sometimes the dosing is inconsistent. That we found that as well. But that's not to say that you can't use natural remedies. It's just to say that if you are going to, it has to be kind of really mild. And especially if you're going to use it for a child, you have to really have some information about the safety. Which some of that will have research studies. Melatonin actually is a natural remedy.
Yeah.
Chamomile tea is something that you can use for anxiety and sleep.
What about
So there's
St.
kind of like
John's
mild
Wort?
things out there, huh?
St. John's Wort?
I have not seen St. John's wort recommended in children. I know sometimes in adults it has been. I have not seen it used as much, but I'm not the one thing is I'm not a naturopath, so
Sure.
I
Yeah.
don't know.
Same
Yeah,
here.
so I don't know, but
Yeah.
I've seen it more so used for maybe older, like young adults and adults I've seen, but
Yes.
it is it's active and so can't be taken alongside with antidepressants because
Yeah.
it has a serotonin action.
Yeah.
So I'd say with natural supplements, it's important to disclose to the
Sure.
doctor if you're taking them so that we can check for drug interactions, but also to check the kind of the source who's providing it to make sure that it's there's certain little certifications that people who provide people who sell natural supplements, there's certain certifications that they can have
Yeah.
to kind
Yeah.
of say that, hey, a body of people kind of verify that this is a safe product.
Yes.
So there are things that are like that are out there. I think for children, you just have to make sure it's really mild. I've seen kids on, kind of mild like drops or things like that are marketed for children. But it's unclear how efficacious it is. So we don't know if it's like a placebo effect or a real effect. These are some of the questions that we have.
This is really great because I think we haven't parsed out as a society real tough issues, right? So, like I think of Ritalin, and I'm thinking of the scare that people have had around, different medicines that they're like, oh, that killed the child, or that did this, or that did that, and kind of really parsing out that argument and really looking at science and facts around it and making a better decision based on that, as opposed to just I feel like, and I've seen and I heard.
Yeah,
So
the emotionality of it, like the fear, because
yeah,
I think there's a lot of kind of like fear around prescribed medications. And there's kind of this sense that if something is natural, it's better. And the truth is that for both sides of it, you have to kind of do things judiciously. So for the medication part that's coming from a pharmaceutical company,
yeah,
it has to be judicious. And most doctors are great, but there's always a small subset of people that they
sure,
prescribe too much. They've given your child too many medications and it was
yeah,
the wrong thing,
yeah,
But then for the natural part of it, sometimes things help, but sometimes they're really not helpful and can be dangerous. And so you have to kind of like be very careful on
yeah.
both ends.
I think that's a really balanced way to think about it, right? You want to measure it, you want to, because you could overdose, and or under, or you could think that this thing is working when in fact it's actually not, because you don't have any rudiments to measure it. And when I think of like medications, I think of the fact that it helps in one area and it seems like it harms in another area. And could that be possibly because, and I don't know, this pops in my head, minerals, right? Because I always think of like, you take your vitamins and you're good, but then they talk about minerals. I'm like, what are minerals? What is that about, right? But I'm just thinking of the combination of things that need to happen in the body and how the body needs to regulate things and bring it to a certain homeostasis for it to be able to effectively work. And so might medications be helping in one area and harming in another, like you said, in terms of like weight gain is coming from this particular thing, because there is not a full balance of nutrients that are needed in the body, or what might be going on there for us.
And it depends on the medication, but a lot of times what ends up happening is, when drugs are created, they try as best as possible to make it specific to the area that they want it to treat. But the body is so complicated, right?
Yes.
So like, let's say, for example, serotonin, right?
Yeah.
There's like this theory that serotonin is involved in mood and anxiety.
Yeah.
But serotonin that is accepted by the brain,
Yeah.
but also accepted by your gut. So when you take a medication that affects serotonin,
Yeah.
and serotonin is in the brain, great. Okay, maybe it will help you with your mood and everything, but it's also in the gut. So now what's going to happen when you mess with the serotonin in the gut is that it's going to cause
Doesn't need to be
diarrhea,
messed with, right?
right? It's going to cause diarrhea. It's going to cause GI symptoms. So now if I prescribe that medication, you could have a little bit of diarrhea,
Yeah.
right? But what we find is that sometimes those other effects kind of go away after a period of time. They're not really present in the long term, and sometimes they stay. So then this is kind of why sometimes we end up with, we're trying to address one thing in one area, but then it causes this problem in another area.
Yeah.
It's very difficult to create drugs that are so clean that they don't cause problems,
Yeah.
just because the body is kind of complicated.
Yeah.
And the things that kind of the causation
Yeah.
for mental health issues is not simple, so that the solution is not simple. Right.
That's fascinating to me, right? Because just in a comical perspective, I'm thinking like, if serotonin is in the brain as well as in the gut, and you give me something to treat my brain serotonin, but I'm getting diarrhea, then that means nothing's wrong with my gut, right? Like that's one way to look at it.
Yeah, yeah.
Say, yeah, there's nothing wrong with my gut, so that's why I have diarrhea, right?
Yeah,
You can learn from everything.
Yeah,
That's the point. Yeah, but yeah, concur with parents that see their children as their responsibility to love and to care for, and to put something that they may feel that is foreign in their body. But at the same time, I say proper research and looking into the information. So I love that you said that it must be an environment where I can ask questions. And
Yeah, yeah.
doctors, right? I am actually loving that. Um, and I think we just need to develop a strong mindset. I'm lost for words with this, but around, I love the fact that the prescriptions that come on your medication are so like booklets of
Yeah,
information, but like who reads that stuff is
right.
one thing. Like we do have to build up. I don't know what word I should use for this, but we've got to get better at reading
Hmm.
the information that is there, and it might be the information, the question, it might gender questions for us to have for the doctor, right? What
Hmm.
does this mean in the description of the medication right here
Right.
when it
Hmm.
says this particular thing, right? Because then you're questioning the facts, and
Hmm.
then you can, then be at a position of making a better decision. Yeah,
And it's always to tell people there's a risk benefit ratio, right?
yeah,
So if the risks outweigh the benefits, then no, do not take this medication.
yeah,
If the benefits outweigh the risks, then maybe that
yeah,
might be something to kind of consider. It all depends on how the mental health condition is
yeah,
affecting the person's life and the kind of severity. When it comes to, like, for example, ADHD, so most common things we treat for kids,
yeah.
there's a lot of kind of thoughts about how is this ADHD medication going to affect my child's brain and like their development and things like that. And the truth is that it just, when a child is properly treated for ADHD, it puts them on a level playing field with their peers.
Hmm.
So that's really kind of how we think about it, is that it's not giving them superpowers. It's just putting them on a level playing field with their peers, because when they have ADHD, they're
Yeah,
having to work 3 times as hard to
yeah,
complete the same homework that their friend did in 10 minutes,
yeah,
you
yeah,
know? And it's like,
yeah,
that's not fair. That's
yeah,
not fair, because your child might be just as smart as them, but
yeah,
now they're just spending twice as long to do the same task with
yeah,
something that we can easily kind of treat. Um,
yeah.
you know,
Dr. Kerry-Ann, do you have a time for just probably two more questions? The last one will
Mhm.
be a bonus fun question.
Okay.
Yeah, this one, because we didn't get to talk about grieving the child I thought I would have,
Oh.
right?
Hmm.
And I think it's perfectly great timing to talk about it when we're thinking about medications and different things like that. So now my child's being diagnosed with something, or I'm noticing some irregularities in my child, some abnormalities, and I'm one accepting it or not accepting it, but I'm kind of grieving the child that I thought I would have. Can you talk a little bit about that, and we can discuss it? Yeah.
Yeah, it's
Or
when
have you seen it in your practice as well?
yeah, it's I'd say that when anybody has as a child, they have all these hopes and dreams for what they're going to be and what they're going to be like, and you hope that they're going to be better than you ever were, and or this, that, or the other. And sometimes there's small things that happen, and it's maybe like, okay, that's fine. They need glasses, or they need braces, or whatever it is, little things. But sometimes it's something big, like they got diagnosed with autism,
Yeah.
or they got diagnosed with some other kind of serious issue, and you think, my goodness, they this is going to be different than I thought. Maybe a chronic health condition. Maybe they got diagnosed with type 1 diabetes, not even mental health.
Yeah.
And so now they're gonna have to monitor their blood sugars for the rest of their life. And it's kind of like, wow, I never thought my child would have to deal with this. I never thought our family would have to deal with this. And I think, for one, people, when they think about grief, they think about somebody dying, you know? And I think kind of that this reframe, that you can experience grief over the loss of a dream or the loss of a hope, a loss of an expectation, that you can actually grieve that in a way like someone, like in a similar but different way as if someone had passed away, that you can actually grieve that loss deeply. It's tricky because it's a kind of loss that sometimes society doesn't recognize. So you can feel very alone with that.
Yeah.
Right. It's like, 'cause there's a type of loss that people tend to just experience in their own families. And so there's an isolating quality to it, which is why sometimes it's helpful to find a community of other people that are in the same situation. And it's to find that as quickly as possible, really. So if you have a child that's diagnosed with autism or a child that's diagnosed with whatever, if you can find a community of other parents that have a similar situation, that is really important, because isolation will lead to, it can lead to depression and things like that, which kind of makes it hard for you to be emotionally available for your child. So that would be one thing to kind of, really think about, but also giving yourself grace to grieve, to kind of experience that emotion, that it doesn't make you a bad parent, that, again, that kind of guilt of like, did I pass these genes on? Did I cause this? And it's like, you don't have any control over what your child's genes are. That's something you have no control over. There's people who have autism that have children that don't have autism. There's no, you really can't decide that. That's not something that you have power over. And so it's kind of that kind of process of just having grace on yourself. You can't control how your child comes out. And so all you can do is kind of like just try to process that, and try to kind of go easy on yourself, and then move forward with, what does my child need from me? So it's a tricky thing, but I think finding that community, because they will have a lot of strategies that they've used to get through this, and they can kind of lift you up. And then also just being kind to yourself and being strong, kind of being there for your child.
And that's perfectly said. I think enjoying that that wonderful, carved out, beautiful individual that was given in your care. I'm always so it's so blessed for me to see parents who have to just know their children, right? Whatever circumstances that they're under, like they know their children, and that is such a blessing, right? To be known and to know your child and love them in that regard. So yes, love it. Thank you.
Yeah, and I remember talking to a parent once, and I kind of described it as a plot twist. Anytime you're watching a movie or reading a book, there's a plot twist at some point. And you think, when the plot twists, you don't look back, you look forward. You just have to keep moving forward. And so yes, the grief is there. But you give yourself space to grieve, but then you kind of look forward, because you have to, out of necessity. When the plot twists, you have to move forward and keep kind of pushing ahead.
Yes, beautiful. I said the last question will be a fun question. Hopefully this is.
Hopefully.
And how do you, at the end of your time here, well, don't make it so dreary, at the end of this career, what do you hope that your work will accomplish?
And like at the end of my career, at the end of after I've done all this work. That's a great question. I've always wanted to be able to kind of change the world by helping individuals. Because individuals go out there, and especially children, I think that's one of the joys of working with children, that you never know what they're going to become. You never know who they're going to be, and you never know who they're going to help. Some people go on to have great positions of power. Some people go on to actually work in the mental health space, and they help other children, they help other people, and they help other families. And so there's like this ripple effect of like people helping one another. And so I always kind of think, if I can help one person to kind of be able to kind of bring their family back together, because this one child that was having a problem, that issue got resolved, and now the family is able to do this. Or, sometimes I work with families, and like, as I treat the child, they're able to get into the college of their dreams. And I think, yes, because of something that I did with my assessment and treatment, I helped them to get back on track. And so now they're able to have the life that they wanted to have. And who knows then in their career what they're going to do to make the world a better place. So for me, I think about at the end of my career, like, I hope that the work that I do helped to make the world a better place, one person at a time, basically, to kind of have that ripple effect of enhancing lives and kind of changing destinies and helping people to be in positions where they can do what they hope to do, kind of live their dreams out, or in any way just be their best self. Because maybe I'm working with someone that has an intellectual disability and maybe they can't be an engineer, but they can be their best selves and they can still bring brightness into the world and make the world a better place in some way, in their best way. And I think whatever I can do to facilitate that, that's the legacy. That's the legacy that you want to leave, is that you made the world better for being in it, and using the strengths that God has given you, you know.
Dr. Kerry-Ann, you are on your way there. You are moving upward at the amazing work that you have done so far. I love that you said earlier on, like the nerdy part of the work, because it is so needed, because it's facts, right? It helps us to get to where we need to go. I am so excited about what God is going to do in your life. Our prayers are for you and for the work that you are doing and the sacrifices that you've made in life to do and to get this far. And so looking forward to that. Guys, if you want to get Dr. Kerry-Ann on your podcast, if you want to find out more about her work, we'll have it in the description. But please check her videos out, Black Mental Health Matters. Yes, and please subscribe to us and like this video. Let's push it out, because there's so many people that want to hear, and that's my sincere ask of you. Not even it's not about my ugly face being out there somewhere. It's definitely about this message being out there and someone being inspired to be the next Dr. Kerry-Ann Williams. And so we're so grateful that you were with us today, and we thank you for your time and for your service to us all. Thank you.
Thank you. Thank you for having me on.
Thank you. Raising and supporting children through trauma, big emotions, and development isn't about perfection. It's about being present. When we acknowledge the weight of mental health, grief, and healing, we create a space for growth. By guiding with discipline, not just disciplining, and fostering self-regulation in both ourselves and our children, we build a stronger relationship rooted in love and awareness. Every child deserves to be understood, and every parent deserves the tools to navigate the journey. Healing is gradual, but it starts with intentionality. One step, one conversation, one act of love at a time. The Factory Voice Lesson. I am Hassan Daniel. We are the Father, and that was your voice lesson.